Welcome to the SDA Housing Podcast, brought to you by NDIS Property Australia. Before starting this episode, we need to provide a general disclaimer. Information contained in this podcast is general in nature only. It does not take into account the objectives, financial situation, or needs of any particular person. You need to consider your financial situation and needs before making any decisions based on the information in this podcast. And you should consider seeking independent and professional advice for your personal circumstances. All right, let's begin.
Hello everyone, my name is Debbie from NDIS Property Australia, and you're listening to the SDA Housing Podcast, a show that explains, highlights, guides and brings awareness about all things SDA in this ever-changing NDIS world. We have a very special guest speaker today. He's going to talk more about, general NDIS, general healthcare industry area. Yes, Lianne Friedman from Universal U. Hi, Lianne. Thank you so much.
Thank you so much
for taking the time to be here. Yeah, we actually met at an event a few weeks back, which was wonderful. You've got a very unique take on talent resources, staffing resources, and we thought we just had to speak to you about what you do and how you're helping the care industry predominantly in Australia.
Awesome. Well, sounds so good. And as I say, thank you so much for having me. And yeah, I'm very excited to share with you and all of your listeners today around offshoring, and specifically offshoring in the healthcare space, which is, that's right, we're seeing is, has huge benefits to companies and how to scale and grow. And yeah, happy to unpack in a lot more detail as we go through.
Please, because look, we know that at the moment, all NDIS providers are just struggling so much with making ends meet, with cost cutting by the NDIS and plans not being renewed or being cut back. So providers are really struggling with their staffing, and obviously that's a major part of any company's budget is staffing costs. So wherever they can help out, or cut out some of those expenses has got to help. And this is exactly where you come in. So Lianne, firstly, tell us a little bit about yourself and the company.
Absolutely. Always love an opportunity to talk about myself. So thank you for opening up that door. So I'm originally from South Africa. I've got over 10 years of management consulting experience. A lot of it in the diversity and inclusion space. I've been on TV and radio more times than I can count, talking about these types of topics. I've been directly and indirectly involved in healthcare for approximately 5 years, and been in senior leadership positions for approximately 6 years, or just over 6 years now, actually. And in my most recent role, prior to joining Universal U, I was GM of corporate services or shared services. For a large nursing agency. We supplied nurses to rural and remote areas across Australia. And my teams were finance, IT, people and culture, marketing. I even had the travel team, because obviously we traveled nurses from one location to the next. So I think that made a pretty good conduit to my role in Universal U as CEO of Universal U, where we are providing those exact services, those corporate services, to a lot of our clients across healthcare in the same way. So it's it's roles like your back end admin, your back end finance and HR. We can obviously get into more details around those specifics, but virtually any role that can be done remotely, or any task that can be done remotely, is exactly what we can support our clients and new clients with. So yes, that's a little bit about our business, and obviously we're able to scale and help our clients scale very, very quickly. To your point earlier around margins and pricing and things like that, and I think this is one of the reasons why it's so important to look at different ways of doing work. When your pricing is set, you can't change your pricing, you can't change your turnover figure. Especially providers in the NDIS space need to start looking at operational expenses and looking at the areas that they can actually move and, have some sort of, benefits over there. So by offshoring, you're able to manage those tight margins a little bit because profit is not a bad thing. No, not at all. It sometimes is a little bit.
We're all in business for that, ultimately.
There we go. And I mean, the more profit a company makes, the more they can grow, and the more, that money can go back into the business, or it can go to shareholders, but it could also go back into the business to provide more care for more participants. So,
and better services, etc.
100%.
Yeah. So that word offshoring, now it's grown massive in Australia. In the last few years, we're constantly being contacted by outsourcing agencies wanting to find us staff from the Philippines predominantly. And we've taken them up, and we have had staff, and we still have staff that are located offshore. But, it's not always a good thing. And I think something that we realised early on was the discrepancy between what we were paying an hourly rate to these very amazing offshore workers, but what they were actually receiving in their pocket at the end of the day from the outsourcing company. And this is where we started the conversation when we met a few weeks back. And tell us why what you do is so different.
It's very different in the sense of it's transparency. I mean, at the end of the day, there's huge cost savings in offshoring. If you look at, fair wages over, and we do offshore to the Philippines. So our team members are earning very good wages. We provide salary banding for our clients. So there is that transparency aspect, which I think is quite unique to the offering that we provide. It isn't a set amount, similar to stories that I've heard, you pay X amounts and the client never actually knows exactly what the staff member earns at the end of the day. So I do completely disagree with that. I think from a transparency point of view, it is important that you know what your worker gets at the end of the day, and that's the process that we take. So we provide profiles to our clients, sort of 2 or 3 profiles after we've gone through the recruitment and screening process. We provide a salary banding, and we talk about where that individual, based on their skills and experience, should sit within that band. So a lot more transparency. And I think it's also a big part of retaining your staff member as well. I mean, if you're underpaying, this isn't an offshoring issue, it's a general staffing issue. If you're underpaying your staff members, they're probably not going to stay around for very long. So from a retention point of view, pay people what they're worth, be fair. And that's definitely one of the factors that we talk about with our clients around that salary banding and transparency of what goes into that fee. So in addition to just the salary, there is also RT and the tech fees that are broken down, as well as to be purely transparent, a management fee to us as well for managing the relationship, the compliance aspect with recruitment with the team members. So yeah, I know when we spoke and had that conversation, it also kind of left a mark in my mind, because if that's what people are thinking offshoring and outsourcing is about, to just change that a little bit. We are one of those companies that are very fair, and we, our clients do know exactly what's going on, and rather than that, one set amount and you never know what your staff member earns, and then they're unhappy and you don't even know why.
Absolutely. We actually have had some offshore staff reach out to us directly and tell us what they're actually earning, and saying, I can't survive on that. Yes, the Philippines is a cheap country, but, where they're only earning $1 or $2 US, and you're paying a lot more at this end, it was quite a shock to learn that.
And it doesn't trickle down to the place that it's supposed to trickle down to. So
yeah,
huge shock. And it's good that you brought up the US part, because offshoring's, of the offshoring market, about 15% of the market is actually in America, with Australia being 15%. So, lagging behind a little bit, but it's definitely something that's going to become a lot more popular and so needed, as we've been talking about those tight margins, and, that work can be done remotely. It's something that's going to, going to become a lot more popular as either a survival or, an opportunity to grow and scale, but, a lot quicker.
So tell us more about what sort of staffing But do you?
I actually spoke to a client about this last week, and I virtually said, and I'm actually trying to quote the exact same words I said last week, but in any role that you can hire in Australia, we can put to market and we can see if we can get you that person in the Philippines. So to take it a little step back in our process, we consult with our clients. That's, very consultative approach, analysis of the workforce to see what skills, what tasks are going to be needing to be done, and what roles can we fill. And we tend to work on sort of a 3-phase process because, as I mentioned, it is a lot about growth and wanting to scale as quick as possible. So we're looking at things like, phase 1 process of potentially business development. I'll talk more about some roles in a moment, but potentially business development that then leads on to maybe, marketing, because you now, got more clients on board, more participants on board. You might need more support workers, in which case recruitment might be the next role. And then because you've got more people on board, maybe finance is the next role. So the point I'm getting to is it's not this one time, okay, we'll do it once and then hands off. It's this continuous, because as your business grows, you will obviously need more resources. So yeah, let's talk about some more roles. So I've mentioned business development reps is a good one. Virtual assistants can be offshore. We've got a lot of admin schedulers and rosterers, so you don't have to schedule your next appointment when you're in the car or walking to the car or on the way to the next appointment. You can get somebody to do that for you. Answering phones. Oh my goodness, I'll actually share a quick story. I phoned somebody, it was a good 3 weeks ago, and he answered, which was great, and then proceeded to tell me that he was actually with the patient at the moment. Could he phone me back? To which I said, of course, please don't worry, phone me back when you're ready. But that kind of, sits with me, because if you're not answering the phones, you're losing out on your next appointment and your next booking. If you are answering your phones, then what kind of customer service are you giving the person who you're with? So yeah, offshoring just simply your reception duties, answering the phone, scheduling your bookings, managing your inbox. We can talk about finance roles. Payroll can be offshored. We've got team members who are ready and available with experience on MyOb and Xero. So yeah, so finance can be offshored, payroll can be offshored, virtually any role. I say to all of my clients after going through that, sort of analysis, let's think about that wish list of what you're looking for. What are the types of core competencies that you're looking for, and what's your minimum requirements? So based off those minimums, if we've got that person in our talent pool, we'll obviously, put them forward. And if not, we then go to market and see what we can get. And we've actually had 2 situations the last probably 3 weeks where we've actually been able to follow that wish list scenario. So I hope that helps and puts it into perspective. Any task that can be done remotely can be offshored, and we can obviously help.
Fantastic. So now you touched on something that I'm also seeing other businesses go in a different direction with, answering phones or answering, chats online. We're now seeing, and I'm wondering how this might affect that. I guess it's just one of the tasks that you can find workers to do. But AI.
Yes. I have some good views on AI, and the concept of, a lot of people say AI is going to take people's jobs. And I don't think that's the case. I think that people who use AI are going to take jobs of people who don't use AI. But I'd also have a concept of human in the loop. So that's, when you're using something like, some technology and AI, there needs to be a human involved at some point in that conversation, whether it's the prompting or it's the review. So I do think AI has a relevant place, but I also think that it's not going to entirely take away the need to have an actual human and a resource. I also think that there's, a bit of a balance and a medium that needs to take place. And what I'm just seeing purely from working with our clients is some are potentially too small to take on, new technology, whether it's AI or something else. So a human resource is a good solution. And then, maybe in time that might change. But, the industry, healthcare is not, you can't get away from having a human. You can't get away from having somebody that you can talk to. So it probably is just a bit of a balance. And then another praise, and using a bit of air quotes over here, is that if you are going to implement some sort of technology, I do think the change management of that is very important, in which case you need resources and you need people to help through that transition, think things through how it's going to affect people and what needs to be done so that you actually get a good tech implementation. So that's another topic and probably another podcast.
Yeah, absolutely. And look, I'm sure that, and I know because we have IT people in the Philippines, and, they're very good at what they do in terms of, implementing that tech. So yeah, you still do need people at the end of the day. So you're quite right. Leads me to another topic, and I'm not sure. I maybe it was a few years ago, talking about offshoring stuff at one stage with NDIS providers, and I was under the impression there was some kind of regulations that everything had to be in Australia, or files or everything online had to remain in Australia, on Australian shores. How does that affect offshore workers working in the NDIS businesses?
Absolutely. So I think you're talking about the data privacy and the Australian privacy principles. I haven't seen anything specifically NDIS related. I have said to a lot of people that I'm talking to, your offshore team is helping you prepare documents, your submissions, your checks and balances. All of those things needs to be done, but that also just needs to be done because of who's submitting it. So that's my stance on that. With regards to the data security and data privacy, this would actually affect all companies, and that is that data cannot leave Australian shores. So in the way that we approach this and supporting our clients, we provide all the tech for our team members. We've got limitations on what they can and can't do. So, for example, no USBs can be plugged into to the laptop, so no data can actually be taken off. But the other important part is just the way that setup is done with the client. So obviously the team member needs to be able to see what, and access systems so that they can do their work. And this is usually done via remote desktop. So the data stays in Australia, and I will defer any further tech questions to our very competent partner in Australia. So we partner with an IT company within Australia, and we actually have set up lots of meetings with them and our clients to make sure 100% that is handled properly, because that is obviously a very, very big and very important factor. So doing as much as we can to make sure that we're fully compliant and our clients are fully compliant.
Yeah. All right. So if we were to hire someone through you, not that we're an NDIS provider, but if we were, their access to our systems. So tell us more about that. I'm getting an impression that you actually have some sort of an interface.
So that's via that remote desktop.
Yeah.
So we provide, think of it in the sense of, so the hardware, and I'm going to use a housing analogy. So we own the house, but the client furnishes it. So the client will put in all of their information, their setup, etc., and that's what the worker is then accessing. So yeah, I hope that analogy is making a bit of sense.
Absolutely. The remote worker comes in and sits at the dining table and eats.
That's it. Uses the kitchen, uses the fridge, accesses it. Yeah.
Okay, great. All right. So yeah, you've obviously put a lot of thought behind how all this works together and how to make it as streamlined as possible and compliant as possible. So who are your main clients? Is it within the industry? Is it within the healthcare industry?
Yeah.
Mix of both, but predominantly one or the other?
Great question. So in the healthcare space, and specifically NDIS providers, veteran care, aged care, and then obviously home care across those. So we are dedicated to the healthcare industry.
Mm-hmm. Yep. Fantastic. And now you are the CEO now. Did you start the business or did you come in and...
I did not. I joined probably about 4 months ago. So the founders across healthcare as well. Started the business and have brought me in to get the word out to the benefits of offshoring. In fact, I'm smiling. I know this is a podcast and not actually you can't actually your listeners can't actually see me. But yeah, we had lots of conversations with the founders before joining and around the strategy and how we're going to launch into the market and how we're going to help as many companies as possible. So no, it's been awesome, great move.
Fantastic. So 4 months is not a lot of time to understand really, I guess, the industry that you've come into, even though you've had a lot of experience on similar type of organizations and areas. But what are the biggest challenges that you're seeing the company's facing?
I definitely think so. I mean, I've got a consulting background, so I've worked for so many different types of businesses and gotten a pretty good grasp pretty quickly. And I think in general, and I'll probably talk quite general because I'm hearing this across aged care as well, of companies closing down. In fact, no, I probably won't talk about that yet because I'm not sure if that's public knowledge. But there's been lots of companies who have who have closed down, and one actually said to me, because I had been talking to him probably about 2 months ago, and when it all happened, he said, "Lianne, we were just too late on the offshoring conversation." So the benefits are obviously there, but yeah, just a little bit too late. So super tight margins, and the thing is, it's around being sustainable and growing. So as much as nobody wants to see any sort of job losses in Australia, being able to offshore means that you're actually saving those jobs, not losing those jobs. So firstly, I'm seeing that's obviously a huge thing. Compliance. Oh my goodness. Now my background in management consulting, there was a component of compliance and audits and verifications and things like that. And I'm seeing across the industry again, there's a huge compliance aspect, and it almost feels like people are spending more time complying than caring. And I know that sounds a little bit controversial.
Yeah, this is what we're hearing all the time as well. The providers are just too busy trying to do their NDIS business and auditing and whatnot to act. They can't actually run their business and do. Yeah.
And that's another concept that I talk a lot about is doing the right job right. So by being able to offshore your admin or managing your LinkedIn page and your marketing, whatever is taking up the mind space, and being able to offshore that means that you can focus on running the business, growing the business, which is important at the end of the day. The other thing that I found quite alarming is I read the report on the state of the disability sector. So I think that was announced, a good couple of weeks ago, and I did actually read the whole thing. I put together a little blog article, and the most surprised, there's a lot that was surprising in there. A lot of it was pretty standard about, lack of profitability and the rising costs, etc. But for me, it was the outlook on the industry. Only 20% of providers anticipated making a profit in the future, down from 60% a couple of years ago. So that was quite surprising to me, because what does that mean for an industry when
that's a very negative outlook?
Hugely negative. What does that mean for participants in the future if only 20% of companies think that they'll be profitable? That doesn't necessarily mean that they'll stay in business. It just means that they, it's just quite dismal. So if we can support and we can turn that around and keep those providers in operation and keep participants with the same provider and not continuity of care and not moving on to another provider, I really can't see the downsides.
Absolutely. Look, it is all about, and it's not just the NDIS, but as you said, the whole healthcare and aged care is also really struggling. So it is all about finding every possible way to make your business more profitable. And obviously all these industries very much based around on the ground staff, the carers, the people that are actually doing that. So if you can find any possible way of managing your costs and your outgoings to support your most important staff, the carers on the ground, and that's got to be a win-win.
Absolutely. I'll share another story from, this was about a week ago or so, and basically busy scheduling. So after an appointment, kind of leaving, walking towards the car and trying to phone up the next person, like, can I go and see you? And it's just, I actually stopped the meeting 1 second and said, is that really the way that you're operating at the moment? Because the way my mind goes is your income producing, being your carer who should be just, client facing with the participant as much as possible, maximizing that time, is on the phone busy scheduling. And to me, that's just, that's an example of something that 100% can be offshore. Make the conversation, line up the appointments for the whole day, the whole week. And it also avoids the situation of needing to, like physically driving and backtracking. So going past a destination and then needing to come back because you just haven't planned that well. So we've got schedulers who, as I said, are able to make calls very easily into Australia and schedule the day so that your support worker can go from appointment to appointment, obviously with the break in between and what they need to do, but not sort of wasting time in between appointments scheduling.
Of course, yeah. What about training? Is that purely up to the hirer, the company hiring these teams? Do you have any part of that?
Yeah, and a little bit of both. Mostly responsibility of the client to train, because the resource is dedicated and working 100% for the client. They can train and make sure that they are getting exactly what they want, the way, get the individual to work the way that they want. So that is definitely a big part of the onboarding and training process. We definitely onboard into our environment. We're talking about the importance of data privacy and data security. So just to emphasize that again, is covered on day one with us. We cover nuances in the Australian environment, how to pull up the map of the country so you know where your client is and you know the location of where they're going to. But that also just makes people, makes the team feel a little bit more connected, because sometimes it can be a little bit isolating being all those thousands of kilometers away. But yeah, predominantly because the resource is 100% dedicated, there is definitely a component of training, but we also 100% support in the background if there's any additional things that are needed. Yeah, absolutely.
Okay, so what should an employer really understand if they're looking at coming to you to get some assistance with offshore stuff?
Yeah, look, I think it's that first process of what are we trying to create? What's the growth? Is it survival, growth strategy? What does the org look like? So I think that's a big part of working out what types of roles can be offshored. And then I really do think that offshoring and managing an offshore team should be viewed in the exact same way as managing an onshore team, in the sense of setting the expectations, being clear with what you are looking for, making sure that there is the right training, coaching, guidance, and then the constant feedback. So I'm seeing that that's something that's sometimes a little bit amiss, and as I said, it's no different to managing an in-person team where feedback is so important, and sometimes that doesn't always happen, which is why I am mentioning that as a key factor.
Yeah, absolutely. I think that was everything I wanted to cover about, who you are and what you do. Is there anything that you wanted to add?
Yeah, I think that we've probably gone through all of the key points. As I said to you earlier, I could probably, talk for another hour if you'd let me. But I think offshoring should just, if I can leave your listeners with one thing, offshoring is something that, it's a different way of doing things. And I do think that where the industry is at the moment, we do need to think of doing things differently, getting a slightly different result, and just, seeing if it works, try it out. And also, keeping in the back of your mind, as I said, just around those points on how to manage the team, how to make that team feel included in the business as well. And it really can be a very successful strategy to scale a business.
And how can people reach Universal You and yourself, Lianne?
I'm going to give you my direct email address. So it's Lianne, but I'm going to spell it because my parents did not go with the controversial spelling of Lianne. So it's Lianne spelled Lianne.F at universal
For Freddie.
F for Freddie, F for Friedman, at universal dash just the letter u.com. So I'll just spell that again. So it's Lianne.F at universalu.com, Lianne.F at universal u, just the letter u.com.
Wonderful. Well, thank you so much, Lianne. Yeah, I think that people really need to, reconsider what outsourcing is all about and offshoring. And I think that what you and Universal U are doing is the way forward with this in the industry. So well done to your team and yourself for what you're putting into the industry. And I wish you the best of success, and hopefully you'll get lots of calls coming out of this episode.
Thank you so much. Really, really appreciate it.
That's okay. Well, that is it for this episode, and we look forward to listening to you, to
that's
chatting with you.
It sounds like I'm coming back. That sounds great.
Yeah, we'd love to have you again. So stay tuned. All right. That's it for now, folks. Talk soon.
We hope you enjoyed this episode. Please make sure you are subscribed and following us so you can keep in the loop with all of our upcoming episodes. We would really appreciate it if you could leave us a 5-star rating, a written review, and to share this podcast with those that could benefit. Until next time, catch you on the next episode.